What role does the provincial health officer play in making this happen, and what role does the Minister of Health play?
Well, under the current visit guidelines or restrictions that we have, we can certainly meet the needs of the current visiting family members who are looking for more time and more personal time with their loved ones. As I said, we can move those visits into the private rooms. And it was, I think, about 62% of the people who responded to this survey were designated visitors. That's what they want. They want more time, they want private time, and they want to be able to deliver those essential care services that they did before. That doesn't require a change in any orders. Allowing additional family members does require a change, and that would be a change from our provincial health officer. I know I've met with the provincial health officer, with the minister, with the medical health officers of each health authority, and with care home operators. And I know everybody is wrestling with this. And certainly, I think the recent numbers in Fraser Health have caused people to pause and to think about what kind of risk is circulating, certainly in the community of Fraser Health at the moment. But we are going to have to, at some point, look at increasing the number of people allowed to visit. As I say, we're coming into 9 months since these restrictions were imposed.
Lisa, do you have a follow-up?
Okay, yes, I do. 9 months. How long? How urgent? Can you express how urgent it is? Can you wait till after Christmas? Can you wait until the spring until we get a new vaccine?
I think the urgency is now. I think the residents have told us very clearly in this survey they are more concerned about being separated from their family members than they are about COVID. Risk is everywhere. Risk is everywhere in long-term care. We aren't protecting these people from dying. In a given year, about 7,500 to 8,000 people in long-term care will pass away. We need to look at what is the quality of life, and we need to look at what we know about managing this virus, how we know if we are screening you, if we are taking your temperature, making you wash your hands, making you wear a mask, limiting the numbers still. Nobody, well, I shouldn't say nobody, there's not a unanimous opinion about anything, but the majority, most people do recognize there need to be some visit restrictions, and most people recognize and support that, actually. But we're talking about a very modest expansion of current visits. So do we start with the designated, you get an additional visitor, or do we start by saying you get an additional visitor if they are an immediate family member, or you get you can change your visitor every month to allow some of these dedicated adult children the ability to see their mom and dad sometime over the next year.
You mentioned you recommend more social visitors, and I've spoken to many family members who basically won't be satisfied until visits kind of are back to their levels during normal times. So I'm wondering here, is the recommendation that that be the case just with the extra screening and mask wearing and that kind of thing, or are we still restricting it to like a select group of people within the family? Like, how is that what are you recommending there?
Well, I think there's wide support for some visit restriction. So we aren't going to return to unrestricted visits with birthday parties with all the grandchildren and the cousins. That will not happen until the pandemic is over. I think we all recognize that. What we're talking about here, again, there's basically two groups of people. There's the people who are already visiting as the designated visitor. They need to have more time with their loved one, and we can do that without increasing risk. The other group are the people who aren't able to visit right now because they're not the designated visitor. And so we need to approach this in a way, from my perspective, and it's what is in my recommendation, that rather than give a blanket number that says you can have one additional visitor or two additional visitors, that it is approached from the perspective of who are the immediate family members and what is the impact of these visit restrictions. And do you have a designated social visitor who comes once a week, and then you might be able to have somebody a daughter who came, who in the past only visited her mom twice a year when she flew out here from Toronto, may still be able to do that. But in the week that she comes, the other social visitor can't come. I think there is a way that it can be managed that will satisfy most. It won't satisfy all. There's no question in the survey that had a unanimous answer. So clearly, what we need to do is look for, okay, what do we really need to do here? Number one, these spouses need more time than 30 minutes once a week outside or in a common room. We need to fix that, and I think we can fix that now. And we're not increasing the risk. Then we need to let more family members in. That one has become more complicated in the last week because of what's been happening in Fraser Health. So I think we need to ask ourselves, okay, if we took Fraser Health out of the equation, what would we be doing? And we need to think about that. I know that has not been how we've approached things to date, but we're now 9 months into these visit restrictions. And then we need to, moving forward, find a way that residents and family members can feel their voices heard. We need to give them a way to do that.
Do you have a follow-up, Eva?
Yeah, you've acknowledged that regardless of all the precautions taken, this is an increased risk, but that's not necessarily a priority for seniors who are nearing the end of their life and who don't want to be alone. But what about how that increased risk is going to put healthcare workers more at risk by exposing them to more people and more visits? How do you balance that?
Well, again, I think we need to remember our layers of detection and layers of protection. So how are they more exposed than if they're going to the shopping, the grocery store, or getting on a bus, or getting in a car with other people, or their kids are coming and going from school? The shared risk is everywhere. And what we're doing is taking personal responsibility around shared risk by making certain that we wash our hands all the time, by wearing a mask, by not gathering with groups of people in social environments. And we're able to do that. There's no record to date of any outbreak in long-term care as being transmitted from a visitor. So we need to look objectively at that. As the care home staff are definitely understaffed, but some of the people who responded to this survey were care home staff. And they also desperately want, some of them desperately want their residents to be able to, if not see more people, spend more time. We need to recognize that not only are these family members essential care partners to their loved one, they're also essential care partners to the system, to a much overburdened long-term care system. When we look at the number of people who were visiting several times a week or daily, and they were helping with personal care, they were feeding, they were mobilizing, they were making sure the hearing aids were in and the hair got combed. Okay, all of those tasks that were done by the family member, who's been doing them? The staff have. They have been absolutely overburdened. And I think the reality of what we're seeing in some of these absolutely objective clinical indicators, like antipsychotic use and our clinical inter-eye assessments, is validating that. So there's a total picture here that we've got to look at, and we've got to listen to these people. These aren't my recommendation. This 13,000 people have said we need more time with our loved one, and it's 9 months.
Arnett, Times columnist.
Hi, thank you very much for this. Given your last answer, how do you make all of those accommodations safe for families, and then possibly make regional recommendations, and at the same time have a recommendation that gets away from the uneven application that we've seen of the rules from home to home?
Well, I think if, first and foremost, I think if visits are allowed in the residence room, and it's by exception that they aren't, a number of the issues we heard about will start to fall off the table. The minute you move those visits to the private rooms, you are going to have, as a care home operator, capacity to manage many more visits during the day. Because right now, you're having to shuffle people out of their 30-minute time slot in the cafeteria because you've got to put another family member in there, and you've got to get the resident there, and then you've got to get them back to their room. And it's extremely, extremely time-consuming. That doesn't solve all of the problems, because you've got the 25% who don't have a private room, and those are going to be trickier to manage. We know that if we increase the amount of time that people can spend with each other, not all, but many of the issues that people are speaking of in this survey are addressed. For example, the widow whose story I highlighted at the beginning, if she could have been with her husband in his room, many of her issues were resolved, and she would have had that meaningful time. Her husband may still have passed away, but she would have been able to be with him when that happened and have had meaningful time with him before it happened. Looking at increasing our numbers from 1 to whether it's 2 or whether it's by exception 2 or whatever the next step is, and I think it will be what we call iterative. We will have to do this, I think, in a responsible way. We've got to, I think, recognize that if over the longer term we are going to see regional eruptions of cases that are going to inform our province-wide policy, we're never going to get to the point where we're going to allow additional people to visit. Because, if not now, then when would be the question. What does it have to look like before we will allow an additional person in? And I think that we might also be giving we should give consideration to more specific direction to some care home operators. I think that there's been, and that also came out clearly, a wide difference in application and interpretation of guidelines, and that was absolutely clear in the essential visits, that it was very differently interpreted by different care homes. And family members are frustrated by that as well. That's what's leading to some of these visits being outdoors or with plexiglass versus being in the residence room. I don't know if that answered your question.
A follow-up, Cindy?
I think I'll clarify the question. So just 2 clarifications then. If the order or the recommendation is expanded on visits, should it be made clear that it applies to all care homes in the province, private, public, or otherwise? And as another clarification, I would ask you to explain the relationship between the rise in antipsychotics from your experience and the visitor restrictions, please.
Okay. So, yes, thank you, Cindy. To be absolutely clear, yes, I think that we need to communicate with absolute clarity to care homes that visits need to happen in the resident's private room. The issues around how visits are managed for residents that don't have private rooms is always going to be difficult to have absolute clarity on, because the circumstances will be very different depending on whether there's 2 people in the room, 4 people in the room, what are the options for common areas, and what are the conditions of the residents. So I think that group of people are always, it's always going to be more difficult to be clear about. And I think we also need to give guidelines around frequency to deliver essential care services. The care homes are still going to have to manage the visits, and the limits don't have to be how many people can I fit in the visiting room, because if you go to the private rooms, your capacity's increased significantly. Almost half of our care homes have got only private rooms. The issue, though, is you need to screen the person. So there's still this, how many people a day, because I absolutely believe we have to do that. And even that we're not doing completely uniformly either, but we're doing a pretty good job of it. You've got to ask them the health screening questions. You need to make sure they wash their hands. You need to take their temperature, and you need to make sure they're wearing a mask. So it is going to take 5-7 minutes per person to be able to do that. So we can only have so many visitors come in during a period of time. So there's still going to be, they've got to be scheduled. But I think we could also look at some type of formula that would determine how many visitors a day could come into a care home. And we would base that on the numbers of rooms, the numbers of private rooms, and make it clear that that's the expectation, and make it clear to family members who they turn to if that expectation is not met, and how it's remedied.